Hi, my name is Abby Larson. For my capstone experience, I was paired with O'Neill Healthcare, specifically the hospice department. My site mentor, Sarah, and I worked to figure out how we can make the transitional process for hospice easier on caregivers and family members who seem to be underserved. So we also realized that OT is a very underutilized resource within hospice, which is crazy because we have the same goals: increasing quality of life, comfort, and providing education. So when we began my proposal, we talked about the different gaps and kind of what she has noticed and different things like that. So we put out a survey that was administered within first 2 weeks of admission for patients, and the family members answered all the questions, kind of trying to figure out where there are gaps in care, where they feel like there could be more. And we also asked a lot of questions about medication management. Do you understand the medications being given to your loved one? Do you feel like you were provided enough education? So we also asked about what they enjoy to do with their family member, what brings them comfort during this time, and spending time with them. Through those results, we realized there were a lot of gaps in medication management. My site mentor had described a lot of pushback on medications just because not a clear understanding, poor health literacy of why my loved one needs this medication. Through this experience, I did gain a lot of knowledge in the hospice care, and I did this through regular team meetings, so daily rounds meetings, biweekly interdisciplinary meetings, and this really gave me a chance to sit in and listen to the daily experiences of visits, whether that's with social work, aides, nursing, physicians, and understanding where are the gaps in care, where are issues coming up, and what could be a better service to the nurses and aides in this time. So through the feedback of the surveys and through all the staff, we had talked about medication logs. So being able to write down when this medication was given, what time, dosage, side effects, everything for these home health patients, because a lot of times the family members are dependent for giving those medications. In addition, we came up with a medication flip book that would provide simple terms on what the medication is, why it's being given, possible side effects, benefits, everything. So there on the left of my poster is the example of the morphine card. Other things we put in the kit included a mouth kit. So a mouth cleaning kit. This was more to allow the family member caregiver just interact and feel a part of the care, able to provide comfort to them. And lastly, we also chose to include some booklets that they had in the facility that explain the dying process, explain the grieving process, so kind of providing a little bit of extra education. Lastly, I just added a handout so that it described every single thing within the kit, what the purpose of it was, how to use it. For the theory that was connected to my capstone, I used the PEO model because it emphasizes how a person, environment, and occupation interact to impact performance. My caregiver toolkit, which is what I ended up calling my deliverable, supports both the caregivers and patients through this transition. The idea with this is that tools like medication logs and medication flip books make medication management easier and provide more comfort to the family member and to the patient, hopefully causing the patient to be able to interact a little bit better with the environment if the correct dosage and everything is given. For example, if morphine is given correctly at the right time, correct dosage, hopefully that patient's more comfortable and can interact with their environment a little bit better, whether that's just spending time with family or even there's groups within the facility. And then came the challenges. For example, again, OT has been underutilized, even though it aligns heavily with quality of life and comfort and providing education. In addition, the gaps in care are difficult to address just due to the lack of resources. My recommendations for the future would be to implement OT practice within hospice care to improve quality of life of patients and their loved ones, as well as provide consistent education. I think this is huge, especially with medication management or just the dying process in general. And lastly, I wanted to support caregivers and family members throughout this transitional process in any way we can. I think that communication with them is huge and understanding what they're going through and being empathetic. But it seemed that their hospice team did an amazing job with this. I really enjoyed my experience. I loved the exposure to hospice care and kind of seeing what OT can do in this type of setting. And currently my deliverable is being implemented, and so far the medication cards have been going well, so we will see. Thank you.